Welcome everybody to Go Local Live. It is Monday, 12 noon. A couple quick updates. The number of cases in Rhode Island are now doubling every 4 days, actually a little quicker than that, and sets out the stage of where we're going to be over the next few weeks. Also, a request by Go Local to Attorney General Peter Nerona's office on cease and desist letters to those retailers and companies that are price gouging was met with a refusal from the Attorney General's office to disclose which companies had been cited with cease and desist. We will be filing an APRA request for those documents, and we'll keep you up to date on which businesses those are that in the Attorney General's mind was price gouging. Let's go to Dr. Michael Fine. Dr. Fine, thanks again for joining us. Let's jump into it. Dr. Anthony Fauci yesterday went on the Sunday morning talk shows, really reiterated, but I think now the country's actually dialed in to what he had said a few weeks ago and we had reported, which is that he expects 100 to 200,000 deaths in the modeling that they're now using. That may be on the low side, he explained, and that there will be millions who are diagnosed with the coronavirus. Your thoughts on those numbers from Dr. Fauci?
Well, remember, there will be many hundreds of millions of cases, because we're essentially all going to get this. The question is only when. How many of those cases will be diagnosed is a function of how much testing we do. The number of projected deaths, it's a painful discussion, but I think the 100 to 200,000 is unfortunately on the low side. If we get away under 1 million, we've done a great job. This is challenging, and it's going to be challenging, and we've got it for, at least 6 months, I think, and more likely 14 to 18 months.
You don't see a vaccine being able to be on the market and available to Americans or the globe in less than a year?
That's what I'm hearing. If it happens sooner, we're going to celebrate. But even if it's available tomorrow, remember, it's going to take us 3 to 6 months to get the nation immunized. We have a real problem because we have a market and not a healthcare system. That is, we don't have a system to make sure we know who everybody who hasn't been vaccinated is, call them in and get them vaccinated. We kind of have to wait for people to walk through the door and sometimes to beg. And for people who don't want to get vaccinated, or are afraid of vaccines, that puts us further and further behind.
Everyone poo-pooed President Trump about 2 weeks ago when he talked about a malaria drug that might potentially be a positive step forward from a healthcare standpoint. That actually is now developing some initial positive testing results. What are you reading? What are you hearing from your colleagues on this?
Well, it's in wide use in hospitals in the United States, but without good scientific evidence. There's a tiny little evidence from a single study in France that suggests it might work, but the study is not of good quality. There's some theoretical reasons for thinking it might work, but again, the devil is going to be in the details. And I don't think this is something that we can rely on until good, standardized double crossover trials, the kind of trials that we rely on, until they've been done. I think everything else is conjecture.
Gotcha. Let's go to the numbers. The numbers are disturbing. American cases obviously are moving quickly, both from a number of cases reported, a reflection of testing, but also the number of deaths.
So the world cases are up about 40,000, actually a little under 40,000, up to about 750,000 reported cases, though the rate of rise fell a little bit yesterday. I suspect that's Sunday reporting, which always is a little slower. U.S. cases are up about 145,000, excuse me, up about 12,000 at a pace a little lower than we had seen. World deaths stand at about 35,000. Again, the rate of growth was a little slower yesterday, and U.S. deaths at about 2,600. Again, a somewhat slower rate of growth, but we'll see what happens over a couple of days. Most painfully, there was one reported death of a 1-year-old in Chicago. Though that's heartbreaking, it is not unexpected for those of us who look at the epidemiology, who look at the numbers. In the world of influenza, we see that rate of about one child death for every 30,000 adult deaths across the nation. We see that every year. It's heartbreaking, but I expected that would happen eventually with coronavirus, and we've seen our first, and I'm afraid it's not going to be our last.
This morning on CNN, they had a in-hospital examination of a city hospital in one of the poorer sections of the city, primarily serving African American and Latinos. And in that hospital each day conducts more than 300 tests. In Rhode Island yesterday, I think we conducted 300 tests. We're now 29 days into the response to the first reported case in Rhode Island. Are we ever going to see a significant improvement in our testing? And if we're not, how do we know when to come out of this and when surges will come and go, other than just straight up hospitalization?
Well, I think we will see an increase in testing. We've doubled the amount of testing over the last week. That's a good thing. The governor has promised we'll get up to 1,000 tests a day by the end of the week. I think that's more aspirational than real, but I think we'll make progress. The National Guard has opened now 3 testing sites, one at RIC, one at CCRI in Warwick, and one at URI, which will help us get the number of tests, but these testing sites don't very well serve the densely populated parts of the state. Talk about African American and poor and underserved populations. So these, you have to have a physician's order, and then get in your car and drive over there. Let me tell you, 22 or 23% of the people in Central Falls don't have their own private cars, so they're not getting tested. And we need to get to the place where we have testing that is ubiquitous, that's all across the state, that everybody has equal access to. And I keep wishing and pushing and begging for the state to devote more attention to these densely populated places where the risk of spread is so much greater. We are way far behind at that, because we're totally dependent on existing, what's sometimes called providers, on hospitals and clinics and private practices to open up their own respiratory care clinics. It's a good thing for them to do it, but this is not the way you run a healthcare system. This is the way you run a market, and it's the market that got us into this problem to begin with.
Listen, healthcare centers as well as anyone, maybe in the nation. What are you hearing from the healthcare centers?
Well, I think healthcare centers are very interested in opening respiratory care centers for their own patients, and sometimes to try to serve their community if they can. They've got to take care of their own patients at the same time. They've got to protect their own healthcare workers, and they're not generally resourced to do this. The ability to do these kinds of things right now depends on the availability of personal protective equipment, and that's being carefully conserved so that we have it for hospital workers when our numbers grow out of proportion. So we're trying to, we're trying to create this delicate balance, increase treatment, or increase, because there's no treatment, increase access to care, increase testing where we can. But it turns out when we start to analyze it, the critical thing that we've got to do is start really working with communities and helping people in communities trust the messaging that they're getting, and helping people in communities know what they have to do to stay safe and know what they have to do if they get sick.
The messaging has been this constant development out of the Raimondo administration, sort of inch by inch tightening the screws. It has created a tremendous amount of confusion, and we know that because of the number of almost endless questions coming into GoLocal via social media or email or even phone calls asking, is this open? Can I do this? Can I do that? It's very difficult to follow, even for a news organization who is watching and recording every second of every word that the governor has spoken for the last month straight. Does she just need to shut down the state and just say, other than these 5 things, everything else is barred from taking place?
Well, I think that is a reasonable strategy, but it's, by itself isn't enough. I think it's got to be combined with a very clear, very simply stated set of messages. Every time every time we hear the word social distancing used, I want to cry, because I don't think that means anything to most of us. Right. We ought to be saying it very simply. Coronavirus is here. It's in our communities and spreading in our communities. Stay home. Avoid other people. Let's stop arguing about 5 or 10 or 15. The number doesn't matter so much as just avoid everybody, pretty much, other than your own family. If you're sick, put on a mask and stay home in a room alone for 7 to 10 days until you're 3 days without symptoms, and make sure your family stays home as well. Pretty simple.
Saturday's announcement.
I say over and over again.
Saturday's announcement was that these retailers are open. These retailers are not. We talked to Tad about it yesterday. Bookstores are closed. Gun shops are open. It just doesn't feel serious enough. That this is, to some degree, no matter how we want to describe it, the single biggest event in American history, arguably since the Second World War.
Yeah, well, history will tell us how big it is, of course, but we have the ability to fix and focus. And I think a lot of the rules and regulations end up being distractions from that central point. We now have police cruisers in Central Falls and Pawtucket going up and down the streets, giving that kind of messaging in a couple of languages over police loudspeakers.
That's now taking place?
It's beginning today.
Yeah.
I think it may have begun yesterday, actually. But that's the kind of, this is real, this is here, this is what you must do, and keep it simple enough so that people understand it and, sort of lie down with it at night and get up with it in the morning and do it without question.
Your message beyond stay home and stay away from everyone, shelter, I think your message is shelter in place in your own home if you think you have any of the signs that you have the coronavirus, correct?
Yeah, it's stay alone. If you think you're sick, if you have any symptoms, go to a room by yourself and stay there alone. There are suggestions about how to do that. Things like, get your food brought on paper plates, and make sure you have, radio and newspaper, and not so much newspaper, but, a computer and things you can do to, and books to read so that you don't go stir crazy. Have what you need to survive in a room alone for 7 to 10 days. You've got to stay alone because and put a mask on when you're in that room, because it turns out that most transmission happens inside houses, among families. And so the challenge is to get people to understand that and protect themselves, but also protect first their families and then the general community.
Doctor, what do you expect to see over the next 3 weeks in Rhode Island?
Well, I think over the next 3 weeks, we will see the opening of hospital extensions, and I'm hoping there will be isolation hospitals built into that. We're going to have to learn to communicate about what it's going to be like for people who are positive to go and get in an isolation hospital. In parallel to the development of that, we are developing more widespread testing, which we need in order for isolation hospitals to be meaningful. Right now, testing doesn't have much meaning, but when we have isolation hospitals, we will get people from one to the other. And I think we're going to see that over the next 3 weeks at the same time as we see the mushrooming of the number of people in the hospital and the number of people in ICUs. It's that's the final common denominator, the number of people in ICUs. And that's the number that I'm watching as closely as I can to tell me when we've hit, when we really beginning to hit surge. I'm also watching how cases rise and fall every day. Go ahead.
Last question. Do Rhode Island hospitals, healthcare workers, frontline emergency workers have enough supplies and protective equipment to carry them through this next 3-week period?
I'm hearing that they probably have enough for 3 weeks, but we're not sure beyond that. That we're worried about the amount of PPE we have. We know we can do it in the short run. The question is, can we do it in the long run? The other critical question that we're not hearing from the daily reporting is how many healthcare workers are COVID positive.
Yeah.
Because that tells us whether we're doing an adequate job protecting the people on the front lines who are critical to everybody's health and well-being.
Yeah, we've certainly gotten some anecdotal reports, at least one Providence police officer, at least one correctional officer at the ACI, and a number of healthcare workers at lifespan hospitals, but we really just don't know anything more than that, and they're not sharing that information. Dr. Fine, I want to thank you, as always, for tuning in. A quick programming note: at 1 o'clock today, Governor Raimondo will have her daily briefing, and at 2 o'clock today, we will have Stephen Pryor, the Secretary of Commerce, on via Skype, talking about what the initial plans are for federal stimulus, how it's going to hit Rhode Island, how it's going to help Rhode Island businesses, as much information as he knows to date, as well as who's open and who's not, and what other further restrictions may be coming down the pike. I want to thank everybody for tuning in. Dr. Fine, as always, thank you. We'll see you back at 1 o'clock with Governor Raimondo's feed. Thank you very much.
Thanks, Josh.